Okay, I think we are ready. Good afternoon. Today we are here to close the gaps that exist at each step in the colorectal cancer journey. First, we'll start with some background. So colorectal cancer is the second leading cause of cancer death in Minnesota, with higher rates in Lincoln and Lake of the Woods County. What's most alarming is that these rates are rapidly rising in the younger adult population, with about an 80% increase since the early 2000s. While Minnesota's average screening rate is above that of the U.S. national average screening rate, certain populations such as Hispanics and Asians are far below these rates. This matters because early detection can lead to a 90% 5-year survival rate. Additionally, colorectal cancer is one of the most expensive cancers to treat, with early stage costing around $66,000 and late stage exceeding upwards of $300,000. So what do these gaps look like in a patient's journey? Let's meet Lauren. Lauren is a married, middle-aged mother from the suburbs of Minnesota. When she first noticed her symptoms, she thought they were due to IBS, leading to a delay in diagnosis. Throughout treatment, Lauren faced anxiety, difficulty managing daily responsibilities, and job loss. Lauren felt alone, but this is the same experience that many other patients face. After completing treatment, Lauren had a significant impact on her quality of life. So what's driving these outcomes? We analyzed this using a fishbone diagram. The core problems we identified include social needs, continuum of care disruption, financial burden, and lack of awareness. It's important to note that these factors do not happen in isolation. They compound over time, making it harder for patients to stay engaged in care and ultimately worsening outcomes. We will reflect on that fishbone as we talk about our 3 pilots today. So the 3 pilots that we are super excited to share with you today are Fit to Screen, Quest for Better Care, and Colon Connect Activity Center. These pilots truly require an interprofessional approach to address social, emotional, and logistical barriers to care. Just some of these members include physicians, pharmacists, nurses, social workers, med informatics teams, and health profession students. Stakeholders are essential to expand screening, improve care coordination, and support our survivors. Some of these members include colorectal cancer survivors, students, Minnesota Department of Health, and national cancer organizations like the National Cancer Institute. And with that, I will pass it to Stacy for our screening pilot.
So our screening pilot, Fit to Screen, aims to increase colorectal cancer screening by distributing 1,200 rapid at-home fit kits to the mHealth Fairview area over 12 months. Currently, many patients don't get screened until after they become symptomatic, leading to delayed diagnoses and worse outcomes. Our pilot aims to shift care earlier, from reactive to preventive. As you can see from Lauren's case, delayed diagnosis is driven by several barriers, including lack of awareness and dismissal of symptoms. Together, these prevent timely screening, which can eventually lead to worse outcomes. Our approach is simple. We want to meet people where they already are. To do this, we use FIT, or the Fecal Immunochemical Test, which is a non-invasive at-home screening tool that can detect small amounts of blood in the stool, which is typically an early sign of colorectal cancer. You can think of this like a COVID test, but for colon cancer. This screening method is quick, accessible, and easy to complete, all while removing barriers such as lab processing, multiple appointments, and other delays. So once patients receive the ARC kit, they complete the test at home and receive results within minutes. If the test is negative, they can continue routine screening. But if it's positive, they are guided to follow up with a provider for a colonoscopy. Each kit will include clear instructions, education materials, and a QR code to help patients connect to care. Because one of the most important barriers when it comes to screening isn't just access, it's knowing what to do next. So our pilot cost will be approximately $75,000 to $125,000 to screen 1,200 individuals with a goal of around 840 completed tests. The key takeaway here is the return on investment. Late-stage colorectal cancer can cost up to $100,000 to $300,000 to treat per patient. So even preventing just 1 or 2 of these late-stage cancers could significantly offset the portion of the pilot cost. This makes our pilot not just clinically effective, but cost-effective. To support this, we focus on community outreach and partnership, including places of worship, community centers, and public advertising, because trust and awareness are just as important as access when it comes to screening. We also have several partners that can act as potential sources of funding and additional support, such as public health organizations, nonprofits, and industry grants, making Fit to Screen not just accessible, but financially sustainable. Now let's reimagine Lauren's story. Instead of being screened after she becomes symptomatic, while she picks up her son from his swim practice, she sees some fit kits being handed out. She takes one home, completes a test, and gets a positive result. She's then guided to follow up with a provider for a colonoscopy. A colonoscopy detects and removes several precancerous polyps, so preventing the cancer before it even develops. But screening is just the first step. The next challenge is to ensure that patients receive timely and coordinated treatment and support. And with that, I lead off to Amanda for the treatment pilot.
So our treatment initiative is Quest for Better Care, and the goal with this initiative is to proactively identify patient barriers while also improving adherence, coordination, and equity throughout the colorectal cancer patient journey. Bringing back our fishbone, we designed this initiative to really highlight a few key areas of concern we identified in both Lauren's case and throughout colorectal cancer care as a whole. And these include areas like care coordination burden, absence of family counseling, and dealing with job loss. So we designed a 3-step process to proactively be able to implement and standardize support into routine care while also increasing utilization of already existing resources through mHealth Fairview. So what does this 3-step process entail? First, patients will receive a supportive care questionnaire through the MyChart system at check-in before each appointment. And this will allow us to continuously assess patient needs as they evolve, such as transportation barriers, financial concerns, or mental health issues as they arise and evolve throughout their journey. And this is a sample of what the questionnaire might look like, which can also be found in your appendix on page 6. Next, responses from the questionnaire will be fed through an integrated dual system AI model to not only help us be able to identify key concerns, but match patients with appropriate resources. So let's walk through an example. Let's say the patient concern is lack of reliable transportation to appointments. The AI model will be able to flag this as a transportation issue and not only be able to suggest an intervention, but also provide eligibility criteria for the patient. And with this step in the initiative, we will be able to provide patients with actionable steps that they can take, but also be able to track our outcomes to help us improve our future recommendations for patients. Finally, patients will receive a clear and actionable summary of the recommended resources that we are providing, in addition to any referrals that were put in place, such as to mental health or social work services. Additionally, within 3 days, a supportive care follow-up will be initiated to ensure that patients were not only able to access the resources that we provided, but are able to understand them to their entirety. So we are proposing an overall cost of $83,000 to $144,500 to be able to implement this 3-step process. We plan to measure success with a 50% increase in patient session adherence, above 90% patient retention after follow-up, and a quarterly questionnaire to measure patient satisfaction with an overall goal of 75% satisfied. And while we are proposing quite a large cost, I want to provide you with this example that even preventing just one missed appointment for each patient in a 300-patient pilot, we can save $60,000. So imagining this in a large-scale healthcare system, the savings would be exponential. Reimagining what Lauren's story might have looked like through treatment, she would have been referred to an oncologist and offered her first questionnaire, giving us the opportunity to identify resources we have available for her based on her individual needs. She would have felt seen and supported and reassured knowing that her needs would be continuously assessed and supported with the help of a holistic healthcare system behind her. And with that, I will pass it to Sabina for survivorship.
For the survivorship phase, we have the Colon Connect Activity Center. Survivors are often left navigating complex lifestyle changes and emotional challenges largely on their own. The Colon Connect Activity Center aims to create a supportive environment where survivors can build meaningful relationships and have access to a variety of resources. This pilot and program is built around a simple but powerful idea. Survivorship should not be experienced in isolation. Again, we have our fishbone diagram highlighting the components addressed by this program. And these include lack of community support and the need for self-care. When designing this pilot, our main focus was to create a strong foundation for this program by starting with a cooking class pilot as a pathway into expansion into broader programs. During our research, we had the opportunity of speaking to a colon cancer survivor. She shared something that really stayed with us. She felt like she didn't have the right cancer story. She felt like her journey didn't fit in with the other journeys shared in traditional support groups, making her feel out of place and disconnected. And this revealed a major gap. Even when support does exist, it does not always feel inclusive. And that insight is truly what shaped this pilot. Instead of functioning as like a traditional support group, the Colon Connect Activity Center is designed to be a multi-dimensional, low-pressure space where survivors can engage through various activities and shared experiences without feeling forced into a traditional model of support. It's designed for a 3-month, bi-monthly program and will be supported by a very wide interprofessional volunteer base, including healthcare professionals, nutritionists, and community and student organizations. We plan to partner with local healthcare organizations, including the Phillips Clinic and the Masonic Cancer Center, as well as partner with community organizations to expand outreach and access to food resources. We anticipate that the initial cost for this pilot will be between $21,000 to $43,100, but it is important to note that a lot of the materials that we purchase for this pilot can be reused, which will significantly reduce ongoing costs. To measure effectiveness of this program, we will use both quantitative and qualitative methods. For example, with goals of a minimum of 70% retention rate and a strong sense of satisfaction in community in our quarterly questionnaire, which can be also found in your appendix. All these metrics will help us see how effective the program is and will also help us with expanding the program into broader services. The potential for growth for this program is significant. It could be expanded across communities, across a variety of different sources, and it could also be enhanced into virtual options to increase accessibility to those who cannot attend in person. Now let's reimagine Lauren's journey. Lauren feels alone in her cancer journey, but comes across a Colon Connect flyer. She attends one of the cooking classes where she builds meaningful relationships with other colon cancer survivors. And for the first time in her cancer journey, she doesn't feel like she's fighting alone. And I'll pass it back to Audrey for closing.
For future targets, we want to expand to high incidence areas like Lincoln and Lake of the Woods County. We also want to scale to include other high burden cancers like lung, breast, and thyroid cancer. Doing this, we are building a scalable framework to decrease mortality rates and provide lifelong community-based support. Lauren's Journey Reimagined shows us how our 3 pilots seamlessly close the gaps across the care continuum. It starts with Fit to Screen, where Lauren accesses an easy at-home test with clear instructions. Next, Quest for Better Care identifies her needs early and connects her to key resources. Finally, through Colon Connect, Lauren finds community, support, and education beyond clinical care. Together, these 3 pilots transform her journey into one that's proactive, care-coordinated, and truly patient-centered. When we address the gaps in care, we don't just treat the cancer. We give patients their lives back. Thank you, and we'll take any questions.